how to read x-rays out loud. If you are a PA student, a PA, a nurse practitioner new to orthopedics, this talk is for you. In the last video, we talked about describing displacement of fractures. In this video, we're going to talk about how to describe the direction of displacement. So you have a fracture, you can describe whether it's displaced, whether it's mild, moderate, or significant, or non-displaced or minimally displaced. How do you describe which direction is it displaced? Well, that all comes down to the anatomic position, which looks like this, where your palms are facing forward and your thumbs are pointing out. So anything away from the midline, which is here, is going to be called lateral, and anything towards the midline is going to be medial. And on this view, anything that way is going to be anterior, anything that way is posterior. So let's take an example of, say, a femur. So a femur looks something like that. And if this is the midline, anything this way we're going to call medial, and anything that way we're going to call lateral. Now let's come up with a scenario where we have a fracture. So let's say this bone is fractured and it went, say, this way. Now, how do we describe which way is that fractured? Because it's a little confusing, because the proximal piece is to the lateral side and the distal piece is toward the medial side. Well, which one is it? Well, what you do is you pretend you are a human being going from proximal to distal, walking on that bone. And the direction you have to turn is the direction that it's displaced, in which case this will be medial. So in this scenario, this would be a medially displaced femur fracture. Same thing occurs on the other plane, the anterior posterior plane. So say this is a femur, looks something like this. So that's our femoral head. Anything this way in the anatomic position is going to be anterior. Anything this way is posterior. Now let's make a fracture out of this. Let's say we fractured the femur and it looks something like this. So you have a hip right there. Which way do we describe the displacement? Like we said, it can be confusing because the proximal fragment is posterior to this fragment, but the distal fragment is anterior to this fragment. Well, again, use the same role. Pretend you are a person walking along the proximal part from proximal to distal. Now, which way do you have to move to get across that fracture? Well, you have to move anteriorly. So this is an anteriorly displaced femur fracture. Now, there are a couple scenarios where medial lateral, anterior posterior can be a little bit confusing, and we have ways to deal with that. We'll talk about that next. Where this gets confusing is the upper extremity. Like we said, the anatomic position is like this, but well, what if you put your hand this way? Well, then it gets a bit confusing. So let's draw, let's say, a wrist fracture. If this is a radius, looks something like this. This is an ulna. And so the thumb would be, over here. You get the rest of the hand right here. Now, if this fractures and it moves one way or the other, let's say for argument's sake, we got this to move, and let's say the fracture went this way. Right, so the ulna is now over here. So everything moved that way. Everything moved that way. Well, which way is it? Is that medial or lateral? Because if this were your right hand, well, we'd say that's medial. But if this were your left hand, it'd be lateral. So it could be confusing. To remove that confusion, we just eliminate medial lateral when it comes to anything past the elbow. We call it, instead of medial to lateral, we say towards the radius or towards the ulna, or in other words, radial or ulnar. So this fracture, we'd say it displaced radially, and if it went the opposite way, we'd say it displaced ulnarly. The same thing applies on the other plane, anything past the elbow. So we're talking forearm, wrist, metacarpals, phalanges, anything past the elbow, we're going to use this terminology. Let's take a radius on a side view. It looks something like this. And, just to make it a little easier, so your thumb is over here and your metacarpal is here. Let's take the example in which, again, we fracture and it displaces this way. So this is a hand, that's the thumb. Now, which way is anterior and which way is posterior, right? So which way is anterior, which way is posterior? It can be also very confusing. So just to eliminate that, if it displaces, or we're referring to the dorsum of the hand or the back of the hand, we're going to call that dorsal. So anything this way, we're going to call dorsal or dorsally displaced. Anything towards the palm side, so this way, we're going to refer to as volar. So instead of medial lateral, we're going to say radial ulnar, and instead of posterior anterior, we're going to say dorsal and volar. And there's another scenario in which posterior and anterior can be confusing, and that is the foot. And we use the same kind of convention. So say we have a foot here. Let's see, it looks like this is the best foot I could draw. There's a little toes here, and here's a malleolus. So similarly, knowing which was an anterior and which is posterior, when we're looking at these directions, which is anterior, which is posterior, depends on the anatomical position. Again, we just get rid of that confusion. If it goes this direction towards the dorsum of the foot, we're going to call it dorsal. And if it's going towards the floor, towards the sole of the foot, we're going to call it plantar. So if you describe fractures displacement as mediolateral or radial ulnar, you'll get it on that plane, versus you can call it anterior posterior or dorsal volar on that plane. And in the foot, we're going to call it dorsal and plantar. So let's look at some x-rays so you have another idea what it looks like. So here's our first x-ray here. We have an AP of a skeletally mature left femur, and it's showing a fracture of the middle third femoral diaphysis. In this talk, we're describing the displacement. Now, first of all, is it mild, moderate, significant? I would say it's moderately displaced. And which way is it displaced? Well, like we said, pretend you're going from proximal to distal. You're walking along this femur, and which way do you have to move to describe this fracture? Well, you have to move laterally. So to say laterally displaced middle third femoral shaft fracture. Next example, a different fracture. This is a lateral of a skeletally mature femur, showing a fracture of the, I would call it middle third, maybe distal third, but let's call it middle third femoral shaft fracture that is significantly displaced, because it's at least 100% displaced. It's more than 100% displaced. Which way is it displaced? Again, pretend you are a person going from proximal to distal, and which way do you have to move? This way, and this direction is posterior, because the kneecap is pointing anterior, back of the knee is posterior. So this is a posterior displaced femoral shaft fracture. Here's an AP and a lateral of a skeletally mature forearm. And we have a significantly displaced radial shaft fracture. And on this plane, on the coronal plane, we call it, which way is it displaced? Well, let's start proximal. We're going to go distal, distal. And where's the fracture? Well, we're going to move this way. Which way is this? Well, like we said, anything past the elbow, we abandon the medial to lateral because it's confusing. We just say, is it going towards the ulnar or is it going towards the radius? Well, in this case, it's going ulnarly. So this is ulnar displacement. And on this lateral view, again, one clue is the thumb. So the dorsum of the hand is this way. The palmar side or the volar side is this way. And so which way is this fracture displaced? So we have the radius here. We're going to walk, 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 walk. And we're moving this way. And this direction is dorsal. So on this plane, we have a dorsally displaced middle third radial shaft fracture.